In recent years, there's been an accelerated use of digital innovations to improve the quality of perinatal care. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter with AHA. Technology has become a critical aspect of healthcare delivery. Digital solutions have provided avenues for improved access to OBGYNs, doulas, lactation consultants, specialists, and more. Apps for remote patient monitoring or chat and text based navigation services offer additional ways to support and coordinate care. To discuss this and more, Priya Bathija, Vice President of AHA Strategic Initiatives, is joined by Sarah Carroll, Senior Director for AVIA's Center for Care Transformation. This podcast kicks off a new series called 7 in 7. In these 7-minute conversations, we'll highlight 7 organizations using a digital solution to improve access and delivery of perinatal care.
Sarah, thank you so much for speaking with me. Can we start with talking about some of the emerging trends in the digital space when it comes to perinatal care? Can you maybe give us the top 3?
Absolutely. And thank you for allowing me to join this wonderful podcast, Priya. I'd say the top 3 emerging trends are related to SMS texting, clinical decision support in labor and delivery, as well as RPM for high risk patients. And I'd like to unpack that a little bit with you. We recognize that SMS texting is accessible and it's actually the preferred communication modality for most US adults. We know that 98% of text messages are opened versus only 20% of email is open. And so, in summary, on this idea of SMS texting, it's so great in a healthcare setting to offer bidirectional navigation to address social needs. Tech support can reduce the uncomfort of asking a human a difficult question, such as the need for transportation to get to a prenatal appointment or the lack of healthy food to support baby's growth. The second trend is really around clinical decision support. In labor and delivery, it's especially important because these solutions are able to chart mothers' and babies' vital signs and overlay algorithms to spot concerning trends and alert the care team before it's too late. We've all heard of heartbreaking stories of women laboring alone in COVID, but perhaps more concerning is the news of women's deaths due to labor complications, especially women of color. And then finally, the third emerging trend is really the big news is remote patient monitoring is growing across all patient populations, but especially for perinatal people. And so, RPM allows moms to better engage in their own self-care by taking their blood pressure and or glucometer readings, sending those vital signs to their care team for analysis between their prenatal care visits, and then escalating any concerning numbers for more proactive care. Also, RPM is gaining traction as CMS has begun increasing reimbursement for this technology after appreciating its value. The leading vendors in this space are demonstrating significant cost savings as well as better quality of care and earlier postpartum care, as well as better outcomes for babies.
Yeah, and that's really exciting to see. So, what are some of the success factors you've seen that hospitals have used as they've designed and integrated digital solutions that have allowed them to really improve outcomes for moms?
Yeah, thanks for that. I'm seeing 5 things that are critical for success. The first is when an organization's leadership and frontline healthcare workers are able to name their challenges, their pain points, their problems, for patients, for their providers, for the business to, articulate the motivation so that colleagues in the organization can better see and feel the need for change. Secondly, it's really the ability to document how you'd improve and measure improvements against those challenges that we call them the key performance indicators. Third thing we're seeing a lot of activity around is seeking solutions that then have demonstrated results in those areas, pairing the right solution to the right problem. A fourth is really identifying change agents that are willing to test the solution and share their perspective on what worked and what didn't for continued improvement. And then finally, we're seeing a lot of important activity to build a strong business case that demonstrates how the business of healthcare could close quality gaps, deliver greater value, help the business grow, increase their margin, and become more attractive to payers and reduce their financial risks from a medical malpractice perspective as well.
That's great, Sarah. And I think one other area where, hospitals can take steps to allow these solutions to be more successful is actually taking steps around digital health equity to make sure that individuals can actually access and understand these solutions. So what are you seeing in this space, and how are hospitals and tech partners working together to make sure that everyone has access to these solutions?
2021 is very different than 2020, 2019, and earlier. For decades, I've seen healthcare organizations and their tech partners benefit from investments to serve the needs of higher income, commercially insured patients. But that's left us with ever increasing disparities. Each organization can ask about the proportion of their innovation budget that's dedicated to serving the underserved and set a goal to close those gaps. I talked a lot about the appeal of SMS texting. The reason it's so attractive is because it's so accessible. It's easily translated into multiple languages. It's easily translated into very short pieces of education for folks who may not have strong health literacy. And also, I think what is very exciting for me is that we've seen organizations, including voices of previously underrepresented patients and providers, in designing initiatives. And that tells me that folks are checking their blind spots for implicit bias. And then finally, we can look for the obvious misses. For example, is our website translated into the languages spoken in our community? How about my chart? Do we approach our work with empathy, love, and a desire to learn from the experience of others? I believe that these little things matter and that they add up to show patients that we care. And when our patients feel that we care, I think that's when we start to build trust and improve lives.
Absolutely. Thank you so much for sharing your thoughts today on this first podcast in our 7 and 7 series. Following our conversation, we'll be releasing 6 more podcasts that highlight 6 hospitals that are using a digital solution to improve perinatal care. Thank you all for listening.